The first exercise is jumping jacks. It represents the abduction and adduction movements, which have the ball and socket joints with the diarthrosis function and synovial structure. Next exercise is jumping rope. It represents the plantar flexion and dorsiflexion, which has the gliding joint. This next clip shows a football being thrown, which represents the extension and pronation, which involves the pivot joint, which has the diarthrosis function and synovial structure. The hand is being maneuvered when the football is being thrown, showing the extension of your upper limbs, as well as pronation because you move your hands forward. Your whole upper limb is connected by a synovial joint, therefore functioning freely. The high knees in this next clip represents flexion and extension. This involves the hinge joint, which has an ampharthrosis function and fibrosis structure. The lower limb is mostly immovable. It can only move forward and backwards. In high knees, you bring your tibia and fibula closer to your femur, which is classified as flexion and extension. The fibrosis joint that holds the lower legs are called syndesmosis. The next exercise is squats. It represents flexion and extension, which involves the hinge joint, which has the ampharthrosis function and the fibrous structure. Lunges involve rotation, which represents the ball and socket joint, which has the ampharthrosis function and cartilaginous structure. Lunges fit into the ball and socket joints because of the amount of maneuvering and rotation allowed. They are classified as ampharthrosis and cartilaginous because of the slight movement where the pubic bone meets in the pelvis. The pull-up exercise represents flexion, which involves the hinge joint, which has the diarthrosis function and the synovial structure. A pull-up is classified as a hinge because of the angular movement, such as flexion, bending in a way that decreases the angle of the joint so that the carpals, radius, and ulna get closer together. Throwing a frisbee represents abduction and adduction, which involves the condylar joint, which has the diarthrosis function and synovial structure. The push-up exercise represents flexion. This involves the hinge joint, which has the diarthrosis function and synovial structure. Bending over represents adduction, which involves the condylar joint, which has the ampharthrosis function and cartilaginous structure.